So you've been admitted to labor and delivery, you're in labor, this is your day to have the baby. So what happens now? Well, first thing is they're going to bring you to your room, which in our hospital is what we call an LDR suite, which is what most hospitals use nowadays. That stands for labor, delivery, and recovery. And the idea is you don't have to move rooms when it's time to deliver. Now, some older hospitals will have a room that you labor in, and then when you get close, they'll move you into a big delivery room, and they'll kind of wheel you down in your bed down the hallway to another room. The hospitals with LDR suites are much nicer, and most modern hospitals now, that's what we're using. So let me show you the typical LDR suite. This is an LDR suite in our hospital. It comes, of course, with a hospital bed, which is pretty clear. There's usually going to be an IV pole, a table, and then they'll give you a gown, you know, the beautiful hospital gown to get undressed and dress in the gown, and a sheet to cover up with. These blue things are called chucks. These are very absorbent, so when your water breaks, they can catch all the stuff that comes out. There's also a lot of equipment in the room. This is a little computer. This is for electronic fetal monitoring. So when they monitor your baby, this will show up on the screen that they can keep an eye on it. In some systems, they also have paper that feeds out so they can see the fetal monitor strip on paper as well. This is the baby warmer. So this is where they can put the baby if the baby needs any kind of attention. And it has a heater on top. There's all kinds of stuff on this to resuscitate the baby if necessary. And so this will sort of be tucked away in the corner. This is a little equipment holder. It's actually locked with a keypad. And there's all kinds of stuff in there like suture and mineral oil and all kinds of things that we might need during the delivery process. And so that's where the nurses can access that. There's a blood pressure machine, and then of course this is very important. These chairs actually lay down and turn into just these beds in the loosest sense of the word, so that the husband can sleep in there while you're laboring as well. So this is the general idea of what an LDR suite looks like. There's also a TV, and the typical amenities you would expect. We have a bathroom and a shower in here as well. And this is the kind of room that you can expect to be in during your labor. This bed actually breaks down. This part here comes off completely, and stirrups come out in which we can put your feet, so we can put your legs up in a position to make delivery, accomplish delivery more easily. This part completely comes off and the bed breaks apart. So these are all kind of clever little devices, all to make labor more comfortable for you, but also safe, and in although a hospital environment, hopefully not too obnoxious.
Medtwice.com